Hello and welcome back, everybody. We're just coming back from our break. So I'll just give a couple of moments for folks to come back to your desks or your couch, wherever you're tuning in from. Thank you so much for everyone who's joined so far and who have just been able to listen to some of our wonderful presenters. I have just been so encouraged and inspired by the remarks that have been shared so far, and really hope that this next portion of the event, which is where we'll really sort of take some time talking a little bit more about where MPHA has been and where we're hoping to go in this new session, is something that you'll really be able to see the connections between our framework and how we're looking at public health and what it is that we're going to be actually practicing, especially in the new session. And so I am going to actually get us started on some trivia before we dive into where it is that we've been. As many of you know, MPHA is a multi-issue organization, and so there are a variety of things that we have worked on. And sometimes for those who aren't in the nitty-gritty of the work day to day, it might be hard to keep track. And so what we figured we would do is do a little bit of trivia to sort of reorient us to the work. And so we're going to start that in a bit. But before we do that, I will just introduce myself. My name is Alexis Walls, and I use she, her pronouns. I am Assistant Campaign Director with MPHA, and I help to lead on a lot of our transportation and environmental justice work at MPHA. I have been here for about 2 years now, and I'm really excited to dive in and just share a little bit more about what we're doing. And so why don't we go ahead and launch our first poll. You all have been able to see some of the questions come across the screen. And so you've had hopefully some time to marinate. And so I'm just going to ask the first one, which is related to our transit justice work. Can you tell us what percentage of people in Massachusetts you believe live within a regional transit authority service area? Or an RTA service area? As a reminder, the RTAs are the 15 transit agencies outside of the greater Boston area. So they serve quite a few communities outside of greater Boston. So we're gonna just sit here with this poll and give folks an opportunity to chime in and share. All right, so we have quite a bit of a spread. So the correct answer to this is actually 55%, which around 30% of you got. There are 55% of people in Massachusetts who live within an RTA service area, which is really staggering when you look at how transit operations are funded by the state of Massachusetts. Even though 55% of people live within an RTA service area, RTAs receive only around 7% of state transit operational dollars. And so this is an area of work that you'll hear a little bit more about when we start to roll out our agenda. But I think we can move on to the next poll. All right, so this is related to our local public health work, which has been a hallmark issue for MPHA. Can some of you tell us how many local boards of health are there in Massachusetts? Is it 200? Is it 50? Is it 140 or is it 351? We'll give you a moment. All right, and let's see what folks had to say. Oh man, majority of you have been paying close attention because 61% got it right. We have 351 independent boards of local health in Massachusetts, which if you are familiar with how local health is set up in other states, this is pretty unique. I think this structure for local health has led to many inequities in public health protections that folks receive across the state. But as many of you know, this is work that MPHA and many of our local health partners have been working on pretty closely for the past few years to try to transform our local public health system. And so you'll hear more about that work in a little bit as well when we roll out our agenda. But good job, everybody. We'll move on to our third question. And so this third question is actually related to housing. And so the question, and this is true or false, is right now, residents can advocate for municipal level rent control policy. Is that true or is that false? Is that true or false? We'll give folks a moment to respond. Okay, and let's see how folks responded. Ooh, so this one is almost split. We have 46% who said true and 54% who said false. And the correct answer is false. So right now, folks cannot advocate for a municipal rent control policy because rent control is banned at the state level in Massachusetts. And so that is a big problem, and it's something that MPHA has been organizing in solidarity with partners around, and you'll hear a little bit more about when we roll out our agenda, but that is false. All right. We're coming to the final stretch. We have just a couple more questions for you. And so this next question is going to come up in a bit, and it's related to environmental justice. You all heard Senate-elect Liz Miranda speak about environmental justice in some of the communities that she serves. And as you'll see in a little bit, environmental justice is certainly an area of work that is really rising to the top for MPHA. There are folks who have been working on many environmental justice issues for years, but this is something that we're wanting to make sure that some of our networks are more aware of and tapped into. And so we have a question here that some of you may not be familiar with. And that is, if we can bring that one back up. There we go. Thank you so much, Ryan. So is this true or false? Siting boards do not currently assess the cumulative impact. So that's the impact over time of the construction of a generating facility or oil, gas, or substation facilities when reviewing proposals for new facilities. That's a mouthful. But what do you think? Is that true or false? All right. Okay. So 79% of you answered true, and you would be correct. Siting boards do not currently assess the cumulative impact of the construction of generating facilities or oil, gas, or substation facilities when they're reviewing proposals. They may gauge the impact that that individual facility will have, but not necessarily the impact that it'll have on the community and the impact that perhaps has been had over time from other facilities that have been built or other types of environmental pollution, like thinking about things like transit, big roadways. And so that is not currently assessed, which is a really big problem for our environmental justice communities that have been overburdened by harmful industry and harmful infrastructure. And so this is something that you'll hear a little bit more about as well when we roll out our policy agenda. There is a bill in particular that some of our partners have been leading on, that MPHA has supported, that we will continue to look at in the new session. We can move on to our next polling question. So this is related to food. Since its launch in 2018, the Massachusetts Food Trust Program has served how many residents across Massachusetts? This one is actually a fill in the blank. So you won't be able to answer through the multiple choice option on trivia, but what you can do is respond in the chat. And so if you want to just sort of throw out how many residents you believe have been served by the Massachusetts Food Trust Program, that would be wonderful. Not enough. 0, Chelsea says. Okay, Kelly Hill says 230,000. We have some around 200,000. Ooh, you all are doing pretty well here. And we're going to talk a little bit more about the Mass Food Trust Program, which is a program that MPHA and partners helped to get launched back in 2018. But we'll talk a little bit more about that later. But why don't we pull up the answer? And many of you are actually very close. The response to this one, or the answer to this one, is 225,000. So many of you are very close. on this. But the Mass Food Trust program has been successful in increasing healthy and affordable food access in low-income communities for over 225,000 residents in Massachusetts. All right. Okay. So we have our last question, which is actually related to our agenda as a whole. And so we're wondering what you all think about this. MPHA leads all coalitions that drive items on the MPHA policy agenda, true or false? Again, MPHA leads all coalitions that drive items on the MPHA policy agenda. Is that true or false? Haha, yes, this was kind of a trick question, but many of you got it right. MPHA does not lead all coalitions that drive items on our agenda. As you all will see in a little bit, there is quite a bit of our work. Well, all of our work really is done in coalition. And so none of this work MPHA drives alone. And there are quite a few issues where MPHA is organizing in solidarity, where we do not play a primary leadership role in driving the strategy, but rather supporting the work of our partners who are doing really great work on the ground in communities and whose values align with our own. And so we can close out this portion of the event. Thank you all so much for participating and being so active. Many of you know our work really well, which is exciting. And I am actually going to turn it back over to Omi, who's going to walk us through where we've been this past year.
Thanks, Alexis. Hi again, everyone. For Alexis and the rest of the policy team launch into what is on the horizon for MPHA, I have been tasked with bringing everyone up to speed on what we've done and where we've been since the last time you attended this conference. So 2022 has been a wild ride, and for MPHA, it's been a year of significant milestones and transition. We continued our multi-year campaign with our partners in the Coalition for Local Public Health to transform our state's public health system into one that provides strong protections to all residents, regardless of race, income, or zip code. Indeed, the pandemic drove home that the systemic changes we have been fighting for are matters of life and death in many communities. Last summer, we held this is last summer meeting 2021, we held a rally attended by over 100 people on the steps of the State House demanding meaningful investments in local public health. And in December of 2021, we made remarkable progress by securing $200 million in ARPA funds to invest in local public health infrastructure across the state. We are deliciously close to seeing our priority legislation, the SAFE 2.0 Act, become law. The legislation provides the blueprint for a 21st century local public health system. The bill advanced through the State House this year, racking up 3 unanimous committee votes, a unanimous vote in the House, and a unanimous vote in the Senate, reaching the governor's desk in July. Unfortunately, if you read our newsletters, you know that the governor returned the bill to the legislature in August with a proposed amendment that would gut the bill. The bill is still pending in the legislature, and we are still working to move it forward in the coming weeks. As you've heard from Alexis and throughout the conference, we partner with communities to build power and agency to change the systems and policy that maintain inequities. Over the last year, we deepened our relationships with partners across issue areas and won several hard-fought victories. Many of these were in the FY23 state budget that passed earlier this year. The FY23 state budget included funding for a number of key public health and health equity priorities, including $15 million to support local and regional boards of health. That's in addition to the $200 million transformational investment. $96.5 million to support regional transit authorities' operations and flexible fare pilot programs. And as part of this funding, all of the regional transit authorities are currently fare-free through the end of the year. We also worked with partners to secure $150 million for the Rental Assistance for Families in Transition, or RAFT program, and included language in that provision that raised the annual benefit cap from $7,000 a year to $10,000. We also helped secure $154 million for the mass rental voucher programs, MRVP, including language to set the tenant rent share at 30% of a household's monthly adjusted income. Perhaps most excitingly, the budget included a provision creating a common application for Mass Health, the Supplemental Nutrition Assistance Program, or SNAP, and other safety net programs, which has been a long-standing priority for MPHA and many of our coalitions. Finally, the budget also maintained funding for upstream strategies to address chronic disease through the Mass in Motion program. And through the long and winding path of this year's economic development bill, MPHA and our partners ensured continued funding for the Mass Food Trust program, which we heard about during the trivia. In addition to advocating for increased funding for regional transit, we worked with our partners on the RTA Advocates Coalition to file the RTA Advancement Bill, which would ensure sustainable funding for RTAs, enhance support for capital projects, and support the electrification of buses, which is key to reaching our state's climate goals. The bill moved favorably out of the Transportation Committee, which is a notable achievement considering that this is the first session that the bill was filed. And while the bill did not pass in full this year, an important provision of the bill that would help electrify RTA bus fleets did pass as part of the legislature's major climate legislation earlier this year. Apart from our legislative victories and hard work, this past year, we were excited to get involved in the 2022 election. We issued a comprehensive questionnaire to all gubernatorial candidates earlier in the summer and called on candidates to elevate public health in the cabinet by creating a Secretary of Public Health on par with, rather than within, Health and Human Services. We published a public health voter guide to help our stakeholders advance public health at the ballot in races up and down the ticket. And we endorsed 2 winning ballot questions, the Fair Share Amendment and Yes on 4 for safer roads. We did all of that through multiple staff transitions. Earlier this year, we bid fair forward to longtime policy director, Maddie Ribble, who left us for warmer weather in California. We also celebrated Christina Kamani, who transitioned into a role at a partner organization after 7 years and many storied victories here at MPHA. Lucky for us, she's just up the street and we still see her on Zoom and in the State House. With that, I'd like to welcome onto the screen the current MPHA policy and campaign team to talk to you about our very exciting agenda for the year ahead. I'll give everyone a moment to figure out their Zoom functions. Well, you've already met Alexis, but I'm delighted to welcome to our team our newest addition, Mahal Alvarez-Bacchus, who joined us just some weeks ago as our new public policy specialist. And I'm also delighted to introduce Janetska Roman, our Assistant Director for Advocacy and Communications. Janetska has a new title. She is taking a bigger role in our communications work. She also leads our work in Coalition on Housing. And returning to the screen is Alexis Walls, our Assistant Director for Campaigns, who does 1,000,001 things and co-convenes the RTA Advocates Coalition for MPHA. And with that, I will turn it over to our fantastic badass policy team.
Great. Thanks so much for the introduction, Omi. Now we're going to be moving on to the presentation of the policy agenda. I just have a couple things that I wanted to note before we move into that section and invite the Policy Council members to join us. So first of all, this agenda includes principles and different types of policies that are going to guide MPHA in the next legislative cycle. Something that I think is really important and excites me about working here is that this agenda was cultivated through partnerships with MPHA Policy Council and other trusted allies. And it really builds upon the MPHA Health Equity Policy Framework that everyone learned about earlier in this session. And in addition to working with partners, we aren't always the lead on a lot of our coalitions, which we learned about during the trivia section. And so you're going to notice that as we move through the agenda, there actually are sections where we kind of follow the lead of trusted partners and the community experts. So without further ado, it is a pleasure to introduce some of these trusted partners. So I'm going to invite Jonathan, Cheryl, and Sophia to join us. And let's see here, just giving everyone a quick second. Great. So Jonathan Guzman is the External Affairs Manager at Groundwork Lawrence. Cheryl Sabara is the Executive Director of the Massachusetts Association of Health Boards. And Sophia Owen is the Staff Attorney at Alternatives for Community and Environment. Thank you all so much for joining us today. So a quick note to attendees as we begin talking through different sections of the agenda. If you have any questions at all, feel free to put them in the Q&A box, and we're going to try to respond to them during the discussion portion. Now, Jonathan, the screen is yours.
Thank you, Mahal, and to all the MPHA staff, specifically also the policy council members and the board directors. As they mentioned, my name is Jonathan Guzman, and I'm the External Affairs Manager for Groundwork Lawrence, and I get the opportunity as one of the MPHA Policy Council members to present our collective principle for transit justice. So our principal statement for transit justice is to advocate for a structuring public transportation to be a well-integrated statewide system that gets all residents where they need to go, particularly people of color, low-income people, people with limited mobility, and people living within a regional transit authority service area. The following are types of policies that we will be supporting, and that is to secure, dedicate, sustainable and progressive funding for RTAs to preserve and expand and electrify transit service, and to also ensure equitable investment of fair share revenue to build and maintain transit infrastructure in environmental justice communities. And we also want to promote accountability to riders in the oversight of transit agencies. And with that, we also are looking to implement free and proven means and other affordable fare structures that increase rider access to the MBTA and the RTA service. And as a Lawrence resident myself, I had to use RTA services at some point in my life, and it gave me and a lot of people that I know the chance to go to a place we needed to go, and which was usually related to access to food, education, healthcare, employment, and other things. And since the Merrimack Valley Transit, MEVA, formerly known as the MBRTA, it became free fares, improved rider access, and it has moved the needle on transit justice. But we must do more for them and to support this environmental justice communities. And the Lawrence Palanta Residents Task Force that happens and is in-house on Groundwork Lawrence has demonstrated the importance of decreasing carbon emission in our city. And therefore, we now need to figure out how to electrify the RTA fleets. And I'm grateful that this is the policy and a commitment that we're doing together as we move forward. Now, I would like to pass it on to my colleague, Cheryl Sabara.
Thank you, Jonathan. I am going to speak about our second policy goal, which is a goal that MPHA has been working on with the Coalition for Local Public Health for several years now. Before probably we started working on this, well, I started working on this about 25 years ago, but we started working on this collectively back in 2018 and 2019. And much of the advancement that we've seen since then has been largely due to the advocacy that MPHA has brought to the table, to the local public health table. When local public health is working the way it should be working, it's pretty silent. And that was sort of underscored by the trivia question where almost 40% of us did not realize that we had 351 local boards of health in Massachusetts. And all of those local boards of health have the authority to pass policy and local laws, but they also, all of them, have the same statutory and regulatory duties and obligations. And if you look at what's happening in Hatfield versus what's happening in Winchester, and you look at the resources in just those two municipalities, you'll see a very huge difference. And as Omi discussed earlier in the meeting, that shouldn't be. It shouldn't matter where you live. You should have access to the same public health services and delivery of services wherever you live in Massachusetts, but that's not the case right now. And one of our policy goals is to assure that the legislation that Omi spoke about, the SAFE bill, which stands for the statewide Accelerated Public Health for Every Community Act, SAFE 2.0, is actually passed and then implemented. So that's one of MPHA's priorities. And basically what the bill would do would be to codify the recommendations that were made by the special commission, which released its report back in 2019, the Blueprint for Public Health Excellence. What that blueprint recommends is that we establish foundational public health standards. We ensure that we have a qualified workforce throughout the state, that we incentivize municipalities to share services, that we create a uniform data collection system, which we don't have currently, and that we dedicate state funding to support local boards of health, and that we continue to invest and support our local public health system. Unfortunately, the pandemic really laid bare some of the inequities in our system when you're looking at issues like systemic racism, essential workforce employees. So we will continue to advocate for this. Hopefully we will get the bill passed because it was supported unanimously. Hopefully we'll get it passed before January, and then we will work toward implementing the bill in its current form. And with that, I am going to pass it to my colleague, Janeska.
Thank you, Cheryl. I'm Janeska Roman. I'm the Assistant Director of Campaign of Communications and Advocacy for MPHA and have been leading our housing work. And we'll be talking more about our housing slate this upcoming session. So as y'all may know, Massachusetts has been experiencing a housing crisis. In recent decades, we've seen skyrocketing costs that have put growing financial pressure on most middle and low income families. And we've also seen that our crisis has worsened during the COVID pandemic, and residents all across the Commonwealth are still feeling the ripple effects of that. We also know that housing and health are intertwined. Access to stable, affordable housing is a key driver of positive health outcomes. Housing stability promotes well-being, it fosters stable employment, it contributes to long-term family and social connections, and also ensures like routine access to healthcare. At the same time, we know that housing and health, like all conditions in our society, are shaped by power, and something that we've been touching upon throughout the conference. And in our current systems, power is consolidated in the hands of few, effectively maintaining and perpetuating inequity. So as we look to next session and we aim to advance housing justice, we are guided by the principle of promoting inclusive communities where all residents can find stable, affordable housing, and shifting that power, building decision-making power to residents that have been harmed by housing policies and practices that have been shaped by structural racism. And I'd also, before I get into the different policies that we are going to support this upcoming session, I'd like to take a moment to thank our partners at the Homes for All Mass Coalition, a statewide formation of grassroots housing justice partners, the MA Coalition to End Homelessness, Justice for Housing, MACDC, and MRI for helping to shape our housing justice policy slate. So as we look forward, we will support policies that lift the ban on the statewide ban on rent control to allow towns and cities to enact rent stabilization measures and tenant protections that meet the unique needs of each community. We will aim to keep people housed by preserving existing affordable housing stock through tenant ownership and improving the quality of housing to improve health outcomes. We'll aim to prevent displacement by expanding tenant and homeowner supports. So in past years, this has looked like really strengthening RAFT, the Rental Assistance for Families in Transition program, MRVP, Massachusetts Rental Voucher Program, and half the Homeowners Assistance Fund in the state budget, and increasing legal representation in eviction proceedings to ensure that everyone has representation when faced with an eviction. And lastly, increasing access to housing through query record sealing and eviction record sealing. And we, look forward to really rolling our sleeves up and hitting the ground with our partners to help, achieve and advance these policies in the next session. So with that, I will hand it over to my colleague Sophia for the next section.
Thank you, Janeska. Hi, everyone. My name is Sophia Owen. I use they and she pronouns, and I'm the senior attorney and the director of ACE's Environmental Justice Legal Services Program. And I'm going to go over the environmental justice pieces of the policy agenda. So the overall goal is to build power in communities that are experiencing high concentrations of pollution, including low-income communities, communities of color, and English as an additional language households, to advance and enforce climate policy that prevents and mitigates the public health impacts of environmental racism. And this includes policies like passing the Energy Facilities Siting Reform Bill to improve public health, safety, and air quality in pollution hotspots around energy facilities, passage of the Access to Justice Bill to increase legal remedies available to individuals harmed by government programs and actions, and increasing indoor and outdoor air quality monitoring and enforcement in environmental justice communities. I'm going to share a couple of stories about ACE's work that illustrate the need for all of these policies. So for almost 30 years, ACE has built the power of communities of color and low-income communities in Massachusetts to eradicate environmental racism and classism, create healthy and sustainable communities, and achieve environmental justice. And we've done that from our home neighborhood of Roxbury in Boston. So for nearly 15 of those years, we have been co-counsel representing residents in Brockton and West Bridgewater who are opposed to a 350 megawatt natural gas power plant proposed to be sited in their neighborhood. And y'all might know Brockton is an environmental justice population. It has one of the highest pediatric asthma rates in the state and has been a hotspot for COVID-19. Multiple attorneys have come and gone from our office, but our commitment to that case has never wavered because siting and permitting processes for polluting facilities continue to be unjust. People of color in Massachusetts have a 70% chance of living in one of the most contaminated communities in our state. For white residents, that chance is a mere 1.9%. The Brockton and West Bridgewater residents raised a number of environmental justice concerns throughout the case, which were not adequately considered by the siting board. Had the siting reform bill been enacted when the Brockton Power case was before the EFSB, it would likely have made a difference. So now I'm going to switch gears a little bit and talk about work on air quality. And over the past year, we've been collaborating much more closely with MPHA on a project that focuses on the public health impacts of poor air quality. As an organization, we've been working on this issue since 1996, when a student at the Phyllis Wheatley Middle School died of a severe asthma attack. This student had been diagnosed with asthma as an infant and lived near the MBTA's Bartlett bus yard, which was located on Washington Street. His death opened other students' eyes to the problems of pollution in Roxbury and caused REAP, our youth program, to begin working to stop dirty diesel emissions and prevent asthma. In the following year, REAP students from 5 schools organized an anti-idling march from Eggleston Square along Washington Street to Nubian Station. Students ticketed city, state, and MBTA diesel vehicles that were breaking the state's anti-idling law, including the buses at Bartlett Yard. In 1998, we created the Clean Buses for Boston Coalition to fight for healthier air by focusing on the MBTA. And today, this work has transformed the entire MBTA fleet to run on compressed natural gas or with diesel engines that filter out 90% of emissions. We're proud that Bartlett Yard closed in 2005 and that Boston's diesel emissions reduction ordinance was passed in 2015 as a result of our organizing and advocacy, and celebrated the passage of the Boston's Building Emissions Reduction and Disclosure Ordinance, which we partnered with the city on in 2021. Unfortunately, despite these local victories, Roxbury has an asthma rate of 15.7%, which is the second highest in the city. Black Bostonians are more likely to die of lung cancer than any other racial or ethnic group, and Roxbury residents are more likely to depend on public transit and to live in a building that is not energy efficient or weatherized. In short, community members do not see the same benefits that energy facilities and other infrastructure, including renewable and electric generating infrastructure, provide to our whiter, wealthier counterparts. So in closing, we see this work as critical because as the state crafts a path to meet our climate goals, electrification will inevitably increase. And although we welcome the phase out of diesel and compressed natural gas and the integration of electric vehicles in our communities, we need a just transition. We can't see places like Roxbury, Brockton, and Chelsea shoulder the burden of electrical substations, power plants, and other polluting infrastructure. Thank you. And I will hand it off now to Alexis.
Thank you so much, Sophia. And thank you for sharing just those powerful stories. I know that we are really excited at MPHA to be elevating environmental justice to a priority area of our work. As you said, there are so many community-based organizations that have been working tirelessly for years on many of these issues. And I think we're just excited that we can come alongside you all and just increase support and be a partner to kind of just continue to amplify some of the work that's happening and hope to bring others within the MPH network along in that as well. I'm just going to speak briefly to sustainable food systems, which is another part of our policy agenda for the new session. So for those of you who have been around and a partner or a supporter of MPHA for a while, you might know that sustainable food systems was once a big part of the MPHA agenda. And as we've gained and sustained some wins and additional organizations have increased their leadership in the food policy space, we've taken a step back. And some of you may even remember that last session, food was not listed as a priority area on our agenda. However, we have continued to hear from partners that it is really important for sustainable food system and food as a social determinant of health to really remain on a public health agenda in the new session. And this has come from our partners who have been working tirelessly on issues like universal school meals, as well as partners who have been working to remove barriers to government benefits and services. And we've also been hearing this from partners as well, who were starting to work more closely closely with who are engaged in the urban agriculture space. And so in the new session, MPHA will support and lead work that ensures all communities have access to healthy, affordable foods by addressing the legacy of racism within food systems, from who controls food production to how food is distributed. And so while some of that work may look like MPHA endorsing food policy that some of our trusted partners bring to us, we will also be leading in 2 areas. And that leadership will ensure continued support for 2 specific programs, one of which was mentioned earlier during the trivia. And so the first that I'll just briefly mention is the Massachusetts Food Trust Program. For those who have been around for a while in the MPHA network, you may know that MPHA and partners helped to launch this program in 2018. And the program provides loans, grants, and business assistance for increasing healthy, affordable food access in low-income communities. Over the year, the program has increased food access for over 225,000 people and has created more than 678 jobs. And so I think this is a really good example of one piece of our work that I think is often we don't talk about as much, which is sort of maintaining what's already been gained. And so when we have, made policy wins, it's really important for us as well as some of our partners to make sure that we're continuing to monitor the implementation of that policy and make sure that those policies or programs receive continued funding and support. And so that is what we will be doing for the Mass Food Trust Program. We will also continue our support of Mass in Motion, which is a Mass Department of Public Health funded program that has begun to make positive changes to policies and living conditions across the Commonwealth. And that's been done through projects that have done things like adopt zoning and regulations that support community agriculture and implement Safe Routes to School initiatives so that infrastructure and policies at the local level support walking and biking to and from school. And so those are just a couple of examples of 2 of the areas that we'll be leading in the food space, and we'll continue to listen to what partners are doing and leading in to see where we can be adding a public health voice to help advance some of that work. So with that being said, I am going to pass it off to my colleague Mahal, who's going to share about a few additional issues that we expect to support in the new session.
Great, thanks so much. So the In Solidarity piece is the next part of our policy agenda, meaning that we're going to be following the lead of trusted partners in order to advance the different policies that promote community stability and health for all people, which include people of color, immigrants, people who are poor, older adults, youth, LGBTQ+ people, women, people with disabilities, and others impacted by the various systems of oppression. So a couple of the things that we are going to be supporting include public health strategies to address drug use and misuse using harm reduction and overdose prevention strategies instead of using prisons and policing. Going off of that, we're also going to be supporting trauma-informed violence prevention strategies that do not expand the carceral system. And as a prison abolitionist myself, I'm very excited about both of those things. We are also going to be trying to improve access to the full continuum of culturally and linguistically appropriate behavioral health supports, specifically for youth and older adults. Finally, we are going to be supporting the trusted experts and partners on reproductive justice policies that support the right to bodily autonomy, the right to have or not to have children, and the right to parent children in safe and sustainable communities. So being in solidarity with places like the Bay State Birth Coalition, Children's Mental Health Campaign, the Massachusetts Coalition to Prevent Gun Violence, and the Massachusetts Coalition for Safe Consumption Sites, that's so important for MPHA because grassroots organizations are the experts on their communities and their issues. These grassroots organizations have built and continue to build capacity and power. And so MPHA wants to be able to support their initiatives and listen to those most impacted by the problems. So that actually concludes the presentation of the agenda, and we're going to be moving into the discussion portion, and that way we can really see how, the staff at MPHA and the Policy Council work together and make decisions and share values.
All right. So just making sure that we're all back. Okay, awesome. All right, and so for this section, we are going to, as Mahal said, we're going to have some discussion. And I think there are some questions that we want to make sure that we're asking one another, but then also just encourage you all to continue to utilize the Q&A function in the bottom panel of your Zoom screen so that you can put in questions that staff and MPHA Policy Council members can ask. And so I think that we can start off perhaps with a question. Policy Council, do you all want to start off with any questions for us, or would you like us to kind of get started? Yeah, okay. Well, I definitely have a question, and I definitely have this question, I think, especially for Sophia, given that environmental justice is an area of work that MPHA is newer to, and that, many might be seeing on our agenda for the first time and interested to learn more about. And so I'm curious to know from you, Sophia, from the perspective of ACE, what do you think MPHA's voice brings to the environmental justice space, and why is it important for an organization like MPHA to put resources and time into amplifying grassroots partners who are doing this work?
That's a great question. Thanks, Alexis. And I guess I would just start by saying that I think, from our perspective, you can't have environmental justice without addressing the impacts of public health on Black, Brown, Indigenous communities and other communities of color. So if and whenever possible, it is helpful to be collaborating with organizations that are focused on public health. I think as was laid bare by COVID, and as we've discussed this morning, there are a lot of ways in which the public health community historically and in the present day continues to cause harm to the same communities that are impacted by environmental racism and injustice. And so amplifying the work of those of us on the ground and the folks living in communities where these issues are life and death is incredibly important. I think we've already seen ways that MPHA has added to our discussion. I think the network that MPHA has of people on the ground doing local public health work and the trust with leaders both in small communities and in some of our biggest cities is really important, and being able to make connections across the silos that have unfortunately been created between public health, environment, and other areas is super important. So really grateful for all that MPHA is doing to get us into rooms where we need to be to have those important conversations.
Yeah, thank you, Sophia. I think that's really important to hear. And it also, you mentioning partnership and, just sort of continuing to make sure that these conversations are happening in the rooms where they need to be happening, kind of makes me think a little bit about the fact that these conversations are sort of being elevated at the federal level. And so we have been seeing more and more announcements for funding for folks that are wanting to do and sort of lead in environmental justice work. But I'm wondering how you were sort of thinking about that influx of funding to address environmental justice and who the recipients of some of those funds might be, because I think there might be a difference between, folks who have been leading that work for a really long time, and others who are kind of like stepping in and recognizing it as important. Are there any sort of like challenges that you foresee coming up in that space?
Yeah, I mean, so it's an interesting time because as folks might know, through the Inflation Reduction Act alone, there are going to be $3 billion coming to EPA over the next 3 years, and some of that money has to be all has to be spent by 2026, I believe. So there's a very tight timeline and a huge opportunity. And I think without careful thought, some of the same inequities that we have seen over the years in terms of who gets the money will continue to play out. I worry that it is going to continue to be large institutions, including health providers, nonprofits potentially in the public health space, and big greens or universities who then are going to be asked to subgrant to smaller organizations, potentially like MPHA, ACE, Groundwork Lawrence, some of the other folks on the Policy Council. And there are two issues with that. One is that it's the larger, more well-funded organizations that are going to be taking a cut of this money and not necessarily doing the direct work. And then also that organizations that may not have a history of doing the work of environmental justice or collaborating with community in trusted and good ways will see the opportunity for money and jump on it. So I guess the ask that I have, or the thing that I've been thinking about, is asking larger organizations and institutions who care about environmental justice but haven't necessarily historically done that work, is to really thoughtfully consider who you can partner with and whether you have relationships with organizations that are doing that work. And if not, pass off the opportunities for funding to those organizations that are.
Thanks, Sophia, for sharing more about that.
I can jump in. I have a question for Mahal, being new to this work. What are you most looking forward to in the upcoming agenda?
Yeah, thanks for the question. So before coming to MPHA, I was actually a certified community health worker at a pediatric mental and behavioral health clinic, doing in-home therapies and working with families and kids, and kind of like coordinating between a variety of like services and healthcare providers. And so for me, I really enjoyed working with the families to implement interventions that could help manage day-to-day social and emotional crises. But what I noticed was that like the kids and the families that I worked with, they were up against much bigger systemic issues that prevented long-term health improvements. So personally, I'm like very excited to see MPHA support increased access to culturally and linguistically appropriate behavioral supports, since that's kind of the world that I come from.
And I know that was a question for Mahal, but I just kind of want to add something in from my perspective, something I'm excited about, and especially just thinking about what Sophia had shared earlier in the just transition framework, and thinking about how we should be looking to do some of this work. I think one of the things that I'm most excited about is continuing to sort of challenge myself. And, I'm sure we'll be doing this as a team and just thinking about what types of policy solutions we are supporting that are responsive to what folks what are responsive to what the needs are, and are really going to address some of the needs that folks are that are rising to the top, and what might be sort of false solutions. And I think that's something that Omi spoke about as well when looking at the health equity policy framework. I know that some of us had time recently to a partner invited us to a training where we learned a little bit more about the just transition framework, and just pushing ourselves a little bit further to think about what it looks like to support policies that go the furthest upstream, and really just kind of shifting power back into the hands of community. And so I'm especially interested in looking at that in our housing work. Yeah, so I just wanted to add that in, because I know that's something that I'm really excited about. But I know, Cheryl, you had also taken yourself off of mute. So
yeah.
Yes,
I did that on purpose.
Okay.
I noticed in the chat that someone had asked, and I don't remember who it is, but it jumped out on me that when we were talking about the solidarity piece, veterans weren't mentioned as a group that we looked at at systemic racism and at various other organizations, but there was no mention of veterans organizations. And I'm wondering if we can just, why that is or isn't.
Yeah, I think that's a really good question. And I think it sort of takes us back. I mean, one thing I'll just sort of point out is, well, so there are two things. One is that while we are leading with structural racism, I think one of the things that we are always thinking about, right, are sort of those intersecting identities that folks have that increase oppression that people experience within different areas that impact health. And so I would just sort of say that while there are some groups that we sort of name, that it is not an exhaustive list, that there are more that might be included. And I've been really grateful for partners who continue to sort of raise that for us, so that if there are groups that we're not having conversations with, that we can make sure that we're in conversation with them. And so that's one thing I think that's one thing that I'll share about sort of how we're looking at the work. I think there are a lot of groups that we sort of name explicitly because they have been left out historically, and marginalized in the conversation, and aren't typically included in conversations that are shaping policy. And so those are groups that we typically tend to prioritize in naming, but that those lists are not always exhaustive, and that we as an organization are always open to exploring partnership or exploring organizations that have values that are similarly aligned with ours, and who work to support other groups that might be marginalized or oppressed. And so I don't know if there's anything else, Janeska or Mahal, that you would add to that, or if there's any other thoughts that other policy council members might have on that. Okay.
So I have a question, and this is for Janeska. I know you've been doing a lot of the work in the housing space, and that MPHA isn't specifically a housing organization. So what do you find most challenging about doing work in solidarity?
Thank you, Sophia. That's a good question. So I think as a statewide policy advocacy organization, working in solidarity with grassroots partners and community-led organizations has challenged the way that we think about our metrics of success. So while our ultimate goal is to have that policy win, we also want to be shifting power along the way. And there are ways to do that throughout. So really taking stock of and trying to make deep relationships with partners, and cultivating those relationships and showing up. Sorry, is my audio being a little bit weird?
It is it's a little weird, Janeska. It's like a little staticky.
Okay, sorry about that, y'all. I'm getting a few messages. I'll try and move a little bit closer. So sorry for the close-up of my face. But going back to that, I think so working in solidarity has really challenged the way that we think about success and how we move forward. So while we want to win like statewide policy, we also want to be building power in community, and that looks like building deep relationships, authentic relationships with the community organizations, showing up in a way that is humble, listening, and doing our best to like support in any way that is needed. So just thinking about our like partnership with the Homes for All Coalition, that has really looked like, you know, wearing different hats at different moments in time in the legislative cycle. So whether that be like, you know, helping to coordinate panels for hearing testimony, helping to, you know, facilitate press conferences, and what have you. So I really think that that is one of the ways that we've been challenged and have been growing in thinking about our partnerships. And again, I apologize for the staticness of my my audio. I'm getting a few messages, so I'm just going to wrap it up. But I did have a similar question for Jonathan. Like as a community organization, what are some challenges that y'all have experienced working with statewide partners, and like how have you overcome those challenges?
Thank you, Janeska. I believe that one of the most challenges piece that we come across is the different capacities in which some are willing to carry out the full advocacy work with partners and others are unable because of that capacity component. And what I see happening constantly is that sometimes it makes an organization take the lead and construct an independent voice with the support of some partners. And it kind of reduces the opportunity to build policy that reflects all within the table because of the capacity challenge. But with every challenge, right, it comes an encouragement, and each organization finds a way to motivate self-reflection and become more of experts in their own social justice advocacy work. And through there, they're able to support others that need that type of background or that framework in order to find constructive ways to make real change. So we see this happening across, right? That everybody is trying to be at that table for advocacy, no matter what the issue is. And unfortunately, sometimes we're not communicating enough, and we're kind of doing the same work and not noticing that we're sometimes fighting against each other, and one priority goes beyond the other one. So I feel like sometimes that can be related to challenges in the capacity level, right, of what people can take on. And divide and conquering is great, but definitely coming to the table together and ensuring that a reflective agenda is always established. And because most of us, or probably all of us, are supporting environmental justice communities, and we want the best in all of these buckets, not just one.
I have a question for Cheryl, kind of going off of like what Jonathan was saying about how each challenge is like an opportunity. And I get to work with Cheryl a lot for a couple of our like coalitions, so I see her a lot on Zoom. But for Cheryl, you are really like an inspiration for me because you've been kind of in the policy field for a long time. And I was wondering what motivates you and, you know, keeps you moving forward.
Thanks for that question. It's interesting. I mean, I became an attorney because I wanted to advocate for and represent people who were having challenges representing themselves. And in this line of work, and I actually, it's not a job that I have, it's a profession, and it's something that I love and that I love doing every day. I mean, people look at local health departments and it a lot of times seems like it's really unsexy work, like inspecting sewer systems, inspecting restaurants, holding flu clinics. But that's not all that local public health is about. Local public health is about making sure that everyone has access to the public services, to the public health services that they deserve. And my days can be very, very different. One of the most intriguing calls I've received this week was a call about a health department that didn't really know what to do because one of the teachers in their public school system wanted to go barefoot when he was teaching math. Interesting question and interesting legal questions. And when we look at local boards of health, they don't have access to their city or town attorney. They have to get permission from the Board of Selectmen or the City Council in order to contact their attorney. So I feel that my agency, the Massachusetts Association of Health Boards, really plays an important role in the lives of these volunteer Board of Health members and these under-resourced staff that are really trying to do the best that they can with very limited resources and with really no access to a legal research engine or cases that may be important to them. So, I mean, I find my work to be, I think it's really sexy and really interesting. And maybe I'm the only person in the state that would find this kind of work interesting, but it's different every day, even though it's the same every day. You know, that the questions can be very similar, but then you'll run into a really unique situation. And it's so important. We can do so much work in policy at the local level. And when we do it at the local level, we get to a tipping point where then the legislature steps in and does it on a bigger level. And that's what keeps me going every day.
Thanks for sharing that, Cheryl. And I just want to uplift something that Jonathan had put in the chat for a few of us, which is supporting the community is sexy. So local health is sexy, Cheryl. Don't let anyone tell you otherwise. I know Janeska's going to close us out in a bit, but there's just one thing I wanted to sort of respond to. And I know that Omi responded in the chat as well, someone asking about the session timeline. And so Omi gave a response in the chat or in the Q&A that folks can see. But one thing I just want to flag about this session is that our new legislative session starts January 4th of 2023. So that's coming up. Bill filing deadline is January 20th. And so, you know, one of the reasons we're excited to be having this conversation with all of you and bringing all of our network into this conversation about our policy agenda is that we need your help. There's so much that has to be done in the environmental justice space. There's so much that needs to be done in the local public health space, in the transportation justice, housing, right? All of these issues that have been mentioned are critical to the stability of our communities. Like, we are truly talking about community stability here. And so we need all of you to be joining us in fighting for some of the policies that are going to help carry forth this agenda. And so please stay tuned from us and get excited and get engaged early next year, because we are going to be calling on you to get co-sponsors for some of the bills